Very good afternoon, everyone. I'm Dr. Faizan. I'm a family physician and occupational health consultant. First of all, thank you all for taking this time today to listen to us and giving this opportunity to share our healthcare proposal and partnering with Eazy Clinics in order to make a community, healthy. At Eazy Clinics, our belief is very simple. Healthy homes create healthy communities. And we do function in an ethos called patient first, clinical excellence, and family friend, and definitely also with a lot of technology. So, and that is exactly what we want to build here at Jal Vayu Towers. Before I start this discussion, I would like to share a small 2-minute story that we lived in our clinic 5 days ago. We were discussing a healthcare proposal with in a corporate HR for a employee wellness partnership sort of model, where the HR himself is a young adult of 33 years old, and came to discuss this proposal in our clinic. After the discussion, we sort of helped him go through the basic vitals, and that was not a doctor visit, but then it was very incidental, where we sort of told them to get these basic tests done. And then, to our surprise, we found that he was having a very high BP of 220 by 120, which is a hypertensive urgency. And until this moment, it was completely silent and completely hidden. He was absolutely fine. And then we took an initiative to give him some medicines, control the BP, get him to hospital. But then it was the first time that in his life he was realizing that he had so much high BP, which we as medical personnel understood that if left untreated will definitely sort of land in complications and further on. Then we went a step ahead and helped him understand the danger signs, helped him understand what he has to do next, where he has to go, what sort of evaluation he needs to do, all of that. But then it's always the first time the patient has a second thought, whether do I need to go for a second visit or different opinions and all of it. We helped him get admitted, get evaluated, and then bring down his BP. And he was, off. I mean, almost the BP came under control of 130 by 90, and we are helping him work towards a lifestyle where he may not need a long-term medications. So now, why do I share this story? Is because to sort of say that what Eazy Clinics does differently than others. We took about 1.5 days for them to actually understand the scenario, how dangerous it is, do a holistic care and approach, sort of reach out to the patient's family and the wife and tell them that this is something that not to be ignored at all. And then we dug deeper and understood the fear of the patient, what he was, why he was hesitant to go to the hospital, all of it, and then we helped him walk through that journey. Now, I see two important things here. One is that a preventive health checkup is very, very, very important, and as well as a continuity of care. So, which is why this patient was, sort of saved from landing up into a complications as such. And that is exactly what we family physicians at Eazy Clinics want to achieve. We don't want to burden people with a lot of unnecessary hospital visits, but at the same time control and care for all the issues, that is, which is almost 70 to 80% that can be handled inside the clinic. And we want to detect early and sort of catch problems before they become a big emergency. And above all of that, give a peace of mind to the patient as well as the family that is going through all of this. And to make this possible, we make this possible by our HPod, which is one of our USP, where you see this machine here is a sort of a health station which is clinically certified and does your BP, sugar, and various other parameters, and various other 24 parameters as such. And this is all non-invasive. To simply give you a sort of analogy or to help you understand, suppose we have two individuals who are weighing about 70 kgs each, and one may probably have muscles built up in it, and one may have probably fats built up in it. But the weighing scale would still show that each of them is 70 kgs. But the HPOD machine, through its body composition analysis, will tell you that what actually is healthier and what just looking as healthy is. So this machine, the health kiosk which we have, does about 24 non-invasive parameters, and as well as does a lot of other invasive tests like detecting dengue, HbA1c, lipid profiles, all of that instantly available for you and is simple and easy to understand. And these are the comprehensive parameters that we help achieve through this health kiosk. And this is the sort of report that an individual going through the HPOD will be able to see in their mobile app, and which has more of the other tests which is not mentioned here. Whatever you see is all of these are non-invasive parameters and which doesn't involve any blood prick or anything, being from the blood pressure to pulse rate, SpO2, and body composition analysis in detailed manner. And this is again one of the detailed analysis and report. To make the care even more simpler, we have something called as Eazy Clinic app, which will be a healthcare companion in the pocket on the go. So if you see the pictures on the slides, these are the interface that how the app looks like, and you can easily store all of your medical records, book your doctor consultations, book your pharmacies, book your lab tests, which can be done at home. And it is a one-stop solution and a one-stop place to go for all the medical history and documents and records. Now, we don't stop at technology. We want to build a healthcare support system for a JVT, and we propose that by doing so by giving you a full-time nursing support and bi-weekly doctor support as well, and an exposure to entire ecosystem of Eazy Clinics where you can avail 24/7 emergency consults or mental health and awareness, and as well as the ambulance. If there is a need for an ambulance, we provide one, which again is within 15 to 20 minutes. And again, given the traffic in the Bangalore, we may not be able to actually promise that at time, but then we have maintained it at around 25 to 30 minutes in past places. And the nurses, again, as Kumar sir was able to say, that the nurse would be able to do all of these injections, nursing care, wound dressings, and all of this care. But most importantly, the nurse will be supervised by us, by the family physicians from the Eazy Clinics, where he will be directly reporting to us, telling us what the patients are going through, taking directions from us on the treatment aspects. And once we understand that the assessment and the need for the nurse to be there and it is sufficient for them to handle the case, we'll make sure that the nurse does it. But when we pick it up that a doctor needs to be present, we will ensure that we come anytime between Monday to Saturday. But at the same time, we will also have a designated time, a day and timings for a doctor visit in Jal Vayu Tower as per mutual agreement. So, but then we also had to think of Jal Vayu in specific. How can we make it even more simpler? We understood the demographics here. Keeping that into consideration, we in fact coined a package which can be used from adult to senior citizens, and that will involve a screening of all of your parameters, be it your vital organs, be it your cardiac health, be it your cancer screening, and which will be coupled by ECG, which will be coupled with free doctor consultation for n number of times, and there will be labs which will be at a discounted price, and the medicines as well. And we have specifically coined this for Jal Vayu. And with this, I extend my deepest respect to this community for helping and building this country and protecting it. And therefore, we ensure that through Eazy Clinics, we provide you a trusted healthcare system which is available, trusted, and accessible as and when you want it. Together, let's make Jal Vayu not just the safest address, but the healthiest community in Bangalore. Thank you.